2020 CDA vendor webinar. My name is Ahmed Tahir, and I will be presenting along with my colleagues, Laura Blum, Wendy Wise, Heather DeBendris, and Amy Webb. We will be presenting primarily CDA-related information that applies to the 2020 release and some future updates which will apply January 2021. This webinar will be recorded and posted on the NHSN CDA submission support portal soon. We do have a lot to present, so let's get started. Next slide, please. All right, and if we can move to the next slide. All right, so we'll start by providing some general NHSN updates. Slide. As a reminder, for those who are familiar with our release schedule, and for those who are new to it, an outline of it, we are continuing with our one major NHSN application release a year, and that major is defined by changes that include changes in the NHSN surveillance protocol that are reflected in the application. Transitions to new CDA versions that stem from those protocol changes are also timed to coincide with the release. And the effective date is January 1st, so that's a big day for us. We also have non-major releases during the year as needed, such as a new component, minor change requests to the application, defect resolutions, and sometimes infrastructure maintenance and support. Next slide. As already indicated, we do have a major release coming up in December. Defects will be effective immediately post-deployment address. Change requests with effective date will be effective January 1st, 2021. Release 9.5 is scheduled for summer 2020 with requests and defects that will be effective immediately post-deployment. And also the neonatal component has been pushed to our December 10.0 release. Next slide. And again, information that may be new to some and old to others is that we do have a defect list at the NHSN webpage. That's a comprehensive list of our known defects for each release, along with information when the schedule fix is going in. Next slide. Our next topic is about the Apec 2020 conference. Unfortunately, due to the coronavirus pandemic, Apec has been canceled for this year. However, NHSN is offering to have teleconferences with those who are interested. Please send an email to the NHSN CDA inbox to schedule a call with the team. Please include any topics of discussion if possible. Next slide. NHSN has recently added a new module to address the current pandemic, COVID-19 patient impact and hospital capacity. Next slide. This module is available to all hospitals currently reporting into the patient safety component. Hospitals can report daily counts of patients with suspected or confirmed COVID-19 diagnosis and current use and availability of hospital beds, ICU beds, and mechanical ventilators. We recently made some updates and are going to be adding reporting for healthcare worker staffing and supplies. You can find a table of instructions on our website at the link listed here on this slide. There will be a training webinar tomorrow, April 14th, from 2 p.m. to 3 p.m. An email was sent out earlier today. Next slide. There are currently two methods available for data submission: manual entry or CSV file upload. CDA might be available in the future, but not at this time. The screenshot on the right shows the fields being collected for patient impact and hospital capacity. We do ask for this data to be submitted on a daily basis. Next slide. The next screenshot here shows the fields for supplies pathway or PPE used by the hospital. This is currently not available for reporting, but will be included in our next release, which is scheduled for tonight. Next slide. The healthcare worker collects data addressing any urgent shortage in hospital staffing and will be included with the upcoming release later tonight. Next slide. NHSN is currently working on allowing a super user, group user, to upload data for all associated facilities. We are still exploring a few options to implement in order to ease the burden for reporting. Please send an email to the main NHSN help desk, nhsn@cdc.gov, with the subject vendor support for NHSN COVID-19 facility reporting, and we will provide guidance. We expect to have a process in place sometime this week. Next slide. Moving into other patient safety updates for release 941, which was deployed last month in March, and our upcoming summer 9.5 release. Reviewing defects that were corrected in 941, defect 9248, when CLIP CDA file was imported with contraindication to chlorhexidine, the application was not saving this field. Defect 9249 was for BSI R3D3 CDA in the vascular site, peripheral IV code 3060-1 was not saved. Defect 9041, NHSN was using the old code for Acrombacter and giving an error on import. Next slide. Defect 9276, during import of a CDA file with pathogen Klebsiella oxytoca, NHSN was saving the pathogen as E. coli. Defect 9184 was only occurring on the UI. Pathogen Enterobacter aerogenes was not rolling up to preferred name Klebsiella aerogenes. Next slide. Defects that will be addressed in the summer 9.5 release. Defect 8683 was allowing a CDA file with an incorrect drug code to be saved instead of giving an error message. Finally, the last two defects do not have any CDA implications. Defect 9165 was occurring only on the UI when an SSI file linked to KPRO procedure, the ICD-10 code field became disabled. Defect 9269 is to allow updated ICD-10 codes to be accepted on import and not show an error message. Next slide. Next, we will discuss some new change requests that will be included in our December 2020 end of the year release. Next slide. CR 2036 removes urinary system infection, USI, from UTI-specific events. USI will be its own event and will be manual entry only. CDA will not work for USI. CR 2263 updates the UTI event criteria for fever. Fever will now be applicable for all ages. CR 2458 is to improve data collection for lines 2 and 3, patient days and admissions. These lines should include all patients housed on select inpatient units. Next slide. CR 2456 is an update to all HAI pathogen susceptibility on the data collection forms. Some drugs will be removed and some drugs will be added to the susceptibility collection, as well as a change in the result value options for existing drugs. This updated list will only be for dates equal to or greater than 2021. CR 2460 is to tighten CLIP rules for patients less than 4 months old. Contraindication will not be selectable prior to entering date of birth and date of insertion. CR 2457 is based on new CMS guidelines. NHSN will allow inclusion of IRF and IPF units, which were previously not allowed from specific NHSN facility types. Next slide. CR 2364 is for the annual pathogen codes list update. This year, there are minimal changes to the pathogen list. Please be sure to use the correct list based on the date of event. And I will now turn it over to Heather.
Thanks, Ahmed. Next slide. As Ahmed mentioned, the 9.4.1 release on March 19th, 2020 resolved several defects related to the antimicrobial use and resistance module. And I'll briefly review 4 of those, which are shown here. Next slide. In 9.4, we've rolled out a new data quality alert, the AR Report No Events RNE alert. This alert appears for a given month when users have a reporting plan in place and have entered AR summary data for that month, but have not entered any AR event data. If the facility truly has no events to report for that month, they can check the RNE box next to the alert to set the RNE value to yes. If they have events to upload, they should do so, which will clear this alert. A defect was sometimes preventing the RNE alert from clearing once AR events were uploaded. As of 9.4.1, the RNE alert correctly disappears once AR events for that month are uploaded. Next slide. Defect 9111 related to 2 pathogens that failed to upload as 2020 AR events. When uploading either Klebsiella aerogenes or Streptococcus augmenti, formerly Group B strep, 2020 events, users would see the error message, validate pathogen effective dates, pathogen is not valid, even though both pathogens were valid in 2020. Note that AR events with dates prior to 2020 uploaded successfully during this time period. Any 2020 AR events with either of these SNOMED codes uploaded prior to the 9.4.1 release did not save properly in the application and will need to be uploaded. Next slide. New drugs added in CR 2125 should be optional for months before 2020. During January 1st, 2020 through March 19th, 2020, CDA files prior to 2020 that contained new optional drugs failed to upload. The application now accepts records containing these new optional drugs for months prior to 2020, and these files can be uploaded as needed. Next slide, please. Thank you. Previously, a defect caused extended spectrum beta-lactamase, ESBL, E. coli events uploaded via clinical document architecture into the CDA application to incorrectly save as Klebsiella oxytoca. This impacted AR, HAI, and dialysis events uploaded into the application from July 18th, 2019 through December 8th, 2019. After the January 21st, 2020 application deployment, a similar error caused any ESBL Klebsiella oxytoca events uploaded via CDA into the application between January 21st and March 19th, 2020 to save incorrectly as an E. coli event. This error has been resolved. All ESBL Klebsiella oxytoca, AR, HAI, and dialysis events created or modified during January 21st through March 19th can now be re-uploaded to ensure they are saved as the appropriate pathogen. With that, I'll hand things over to Laura Blum.
Thank you, Heather. My name is Laura Blum, and I'm one of the SMEs for the NHSN AUR module. Today, I'll be telling you about defects and change request updates for the NHSN AUR module 9.5 release. Next slide. Defect 9052 fixes an issue with the Antimicrobial Ingredients 2020 tab of the IDM. The NHSN team removed telithromycin and ticarcillin with clavulanate from the list of AR option antimicrobials in 2019. These antimicrobials incorrectly appear in the Antimicrobial Ingredients 2020 tab of the IDM for the AR option. Telithromycin appears in Anti-P 25 and 27, and ticarcillin with clavulanate appears in Anti-P 20, 22, and 26. Defect 9052 removes telithromycin and ticarcillin with clavulanate from the Antimicrobial Ingredients 2020 tab, as NHSN does not accept them in 2020 files. Next slide. Change request 2410 creates new AU and AR primary contact types within NHSN. The NHSN team currently sends communications and outreach about the AUR module to the NHSN facility administrator, patient safety primary contact, and all active users. However, we would prefer to send information to the most relevant point of contact at each facility. Change request 2410 adds the ability for facilities to designate a point of contact for the AU option and AR option within NHSN. Next slide. Change request 2419 updates the maximum value for the minimum inhibitory concentration, or MIC, E-test, and Kirby-Bauer, or KB test, within NHSN. Currently, the maximum value of the MIC, E-test, and KB test accepted by NHSN during CDA upload is 999.99. Lab reported results for these tests can be greater than 2,000. Change request 2419 changes the maximum value for the MIC, E-test, and KB test results accepted by NHSN during CDA upload to 9,999.99. Now I'll hand it over to Amy Webb to talk about AUR Module 10.0 updates.
Thank you, Laura. All right, so then as Ahmed mentioned, 10.0 is scheduled for December of this year. So I'll be covering the changes for the AUR module that are scheduled for December. So the first main change for our AU option is to update the drugs required for reporting for 2021. We will be adding 4 new drugs to the AU option and removing 3 drugs. So this next slide shows a summary of the last 4 years of changes that we've made. As you remember, for 2020, we added 6 new drugs and removed 6. So 2021, we are going to continue that pattern of adding and then removing if necessary. So we will be adding the 4 new drugs and removing the 3. I did want to point out that amphotericin B lipid complex, as well as colistin that was added this year, they're not newly approved FDA drugs. Instead, we are adding them as separate drugs for AU option reporting because they do have separate RX norm codes. So we're trying to clean up some of those issues as well. Okay, so for 10.0 for the AR option, we are adding the ability to report no events within the AR summary CDA. So right now, users can report no AR events within the user interface only. However, using the newly updated IG for AR summary data, the R3D4, vendors will be able to report no AR events for within the AR summary record. This new IG can be used for records from January 2021 and greater only. It will not be available for 2020 records, for example. For records prior to January 2021, you must still use the R1 norm IG and manually check that no events box in the UI. The section would be excluded from your AR summary CDA file if either the facility did identify AR events for that month, or if you as a vendor chose not to report that item, and the facility could still then continue to use the UI to report no events. Also, for the AR option, we'll be adding the ability to report AR summary data from select outpatient locations. So currently, facilities report AR summary data for FACWIDEN only. Starting with the January 2021, facilities will also be able to report AR summary data from the 3 outpatient location types of emergency department, pediatric emergency department, and 24-hour observation area. If these locations are listed in the reporting plan, then facilities must upload both AR summary data and AR events if they've been identified. And again, this feature is only available via the R3D4 IG only, so records greater than or equal to January 2021. For records prior to this date, we will not be accepting AR summary data from these outpatient location types. So in summary, for the AR summary IG, If your summary records are for December 2020 or prior, use the R1 norm IG. If they're for January 2021 or later, you'll use the R3D4 IG. All right, one large change we are making for the AR option for 2021 was related to the pathogens. So our goal for 2021 is to obtain a more complete picture of the pathogens identified that fit within our AR option protocol and to provide more standardized guidance for reporting. So we will continue to use the pathogen codes tab in the IDM like you all use right now and you're familiar with. We will be adding 41 new pathogens to the ARO pathogen column. So we'll be adding an X in that column. And these specific SNOMED codes will be accepted into NHSN. So when you review the pathogen codes 2021 tab, you'll see these 41 new X's. Some are preferred terms and some are synonyms, so it's not 41 new SNOMED codes, just 41 new rows basically in the pathogen codes column. So that is new, you're all used to that. Or sorry, that is what you're all used to. What is new for 2021 is that we will expect facilities to report error events identified within an expanded value set. This value set includes around 900 additional SNOMED codes. So these extra codes include species, subspecies, serotype and serogroup, as well as antimicrobial susceptibility terms that we don't currently capture. And when folks ask us, I have these specific SNOMED codes for the E. coli serotype that were identified, can I report them? Right now, we have to say no because we are not giving everyone that same guidance. So this change is an effort to standardize our instructions of which pathogens can be reported to NHSN. So I'll cover this a little bit more in the next slide, but we will not be adding all these 900 to our pathogen codes tab in the IDM. As you can imagine, that would be a very big maintenance burden for us. And as such, the specific SNOMED codes will not be accepted into NHSN. So how it's going to work is we are going to have what we're currently calling an AR option pathogen roll-up workbook that will provide to facilities and vendors to standardize the mapping and reporting across all submitters. So this workbook will list the SNOMED codes and fully specified names and the corresponding codes and names that the pathogen should be rolled up to prior to being populated in the AR event CDA. So I'll go through a couple examples here. So highlighted in row 144 here, if the lab reported the specific SNOMED code for extended spectrum beta-lactamase producing E. coli or ESBL E. coli, that code is currently accepted by NHSN. So you would not have anything to roll up to. You would simply report that code in your AR event. However, if the lab reported the specific SNOMED code for multiple drug-resistant E. coli or MDR E. coli, that code is not currently accepted by NHSN, but we would want you to be rolling that up and reporting it to us as regular E. coli using the regular E. coli code. So you would use columns D and E to know what to roll up to. The workbook will be provided as soon as we finalize it. We are still reviewing and going through some draft versions. If you have feedback as to what to include in columns D and E, the roll-up for pathogens that are currently accepted. So right now we're using NA for columns D and E if that pathogen is already accepted. So for example, rows 143 and 144 for E. coli and ESBL E. coli, just list NA. If it would be more helpful for you to actually have just put E. coli and ESBL E. coli in those two rows, please let us know, and we're happy to do that. That is all I have right now. I want to take a quick pause and see if we can fix the issue that some folks are seeing with the slides. So I'm going to exit out of presentation mode and try to present again. And Emily or Ahmed, can you tell me if that fixes the issue or if I should share a different screen?
Hey, Amy, it's only a couple of slides that go down to the very bottom, so I don't think it will be a problem for the remainder of this call.
Okay, sorry about that. You all do have the PDF version of the slides you can refer to if you're not able to see the bottom parts of the slide. So we will continue on. So one last slide I have for y'all, just a quick overview of our facility outreach efforts. As you can imagine, all non-urgent facility outreach has been paused at this time. So that includes everything for AUR, but also HAI and the other modules as well. So we do a lot of outreach regarding NHSN defects and or just various data quality topic for various items. So all of that has been paused now. From the AUR team, we've in the past and planning in the future to send out outreach regarding the defects that you've heard about today, some missing AR susceptibility information, reporting use of drugs that are no longer commercially available for the AU option, discrepancies between denominators, and then just various location mapping issues. A lot of these items do require re-upload of data, and we do try to coordinate with vendors as possible. And sometimes that's not always possible, but we try to do our best. But if you do get questions from your facilities based on outreach that we've sent or will send, please always reach out to us with any questions you have about that. So now I'm going to turn it over to Wendy.
Thank you, Amy. I'm Wendy Wise, one of the AUR module SMEs. Today I'm going to primarily discuss AU synthetic data set validation and then a quick note about AR SDS. Next slide, please. Specifically, I'm going to share information about the AU SDS timeline, new resources created since our last CDA webinar, review the high-level steps for submitting AU SDS for validation, discuss the frequency of validation, review the CDA author section, and a quick AR SDS update. Next slide, please. We've shared the AU SDS timeline on the last several CDA vendor webinar calls. As you can see, we are in the validation phase-in period with the AU synthetic data set validation requirement just around the corner in 2021. In the first few months of 2020, we've had several vendors pass AU SDS validation. All verified vendors and their software are posted on a public-facing NHSN webpage. This allows current and future customers to be aware of vendor services and successes with respect to the NHSN AU option validation. Please keep in mind that beginning in 2021, all 2021 AU CDA files that do not contain required SDS information will fail to import into NHSN. Next slide, please. We've redesigned the main AU SDS webpage and added resources. We now have FAQs posted, instructions for how to obtain a vendor OID, and a page that lists the vendors that have passed AU SDS validation. The links are on this slide, as you can see, but I'll share a screenshot of each and go into a little bit more detail on the next few slides. Next slide, please. Here's a screenshot of our main AU SDS validation webpage. This webpage has the downloadable AU synthetic data set with instructions in a zip file. On the top right, the menu shows the other sections that are listed on the web page. The See Also menu just below that has quick links to the other 3 topic areas that I'll show on the next few slides. Next slide, please. Obtaining vendor OID web page is fairly self-explanatory. Please note that we are also now asking that you copy the NHSN CDA at cdc.gov mailbox on this request. We'll be updating these instructions online in the near future to include this. Also note that vendor OID is sometimes referred to as the vendor application OID. Vendor OID is different and unique from the facility OID. The vendor OID is assigned by FinTech and is unique for each vendor. This has raised some questions recently, so let me state this in another way as well. Vendor OID does not replace the facility OID. The NHSN application uses the facility OID to identify the facility in each CDA file so that the data can be uploaded into the appropriate NHSN facility. NHSN uses the vendor OID to track the SDS validation status of vendors and their software. Both OIDs will be needed on the AU CDA files. Please continue to include facility OID as you have been doing in that section of the AU CDA. So jumping back to the email to FinTech, in response to your email to FinTech, you will receive a vendor OID. I've noticed that they've turned around these requests fairly quickly within a week or so. So just to reiterate, the vendor OID will be required in the author section of the AU CDA once the vendor passes AU SDS validation. Next slide, please. We currently have 22 AU SDS related FAQs, and we're about to post at least one more. I highly encourage you to review these FAQs at the beginning of embarking on AU SDS validation and throughout the process. Some things may not quite click until you're further along in the AU SDS validation process, but having the AU SDS FAQs handy can help answer questions as they pop up for you. Next slide, please. The last new web page I wanted to share today is the vendors that have passed the AU SDS validation web page. As you can see from this screenshot, we have a table which includes the vendor name, including a hyperlink to the vendor's website that the vendor can optionally provide us, as well as the vendor software name, version or release, and the date the vendor passed validation. The table is organized alphabetically, so as new vendors pass AU SDS, they'll be inserted in alphabetically. I also want to point out the new certification badge in the top right corner. We'll email you that badge once you successfully complete AU SDS validation. You can feel free to include this badge on your website or vendor material once your software has been validated. Next slide, please. This slide shows at a very high level the steps to take for completing AU SDS validation. You first should download the AU synthetic dataset and the accompanying instructions. I've included the link on this slide. After thoroughly reading the instructions document, I would also recommend reviewing the AU SDS FAQs like I mentioned on the previous slide to gain additional information or help to answer some common questions that you might have. I've included the link here again. In general though, you should process the AU synthetic data set through your vendor system just like you would with regular facility AU data. You should aggregate the data following the AUR module protocol for the AU option. However, for AU SDS validation, the output should be in an Excel format so that we can confirm you've aggregated the AU data properly. Remember, AU SDS validation is intended for use in testing numerator and denominator data aggregation, not for conformance to CDA AU reporting. Next, you would upload that file to the NHSN SDS validation web service that will validate your aggregated AU data against an answer key. This last step of your internal testing can be done as many times as needed to check your aggregated data against the answer key. Next slide, please. One important note about the NHSN SDS validation web service It has come to our attention that vendor systems have varying capabilities for capturing all drugs and all routes. If your system is not capable of reporting blank or null values for some of the routes of administration while reporting values for other routes, for example, reporting null for penicillin 5 respiratory route while reporting numeric values for the remaining routes, then please use this first link to validate your SDS file, the link that's in the first bullet on this slide. If your system can report blank or null values for some of the routes while reporting numerical values for others, please use the second link to validate your SDS file. So just to recap, you only need to submit and test against one of these URLs, not both. It depends on your specific situation as described on this slide. The NHSN team does need to know which URL you use for testing, as you will see when I explain it on the next slide. We will be updating the AUSDS instructions in the downloadable file in the near future to include this information. But in the interim, if you have any questions, please do not hesitate to contact us. Next slide, please. So once ready, send the NHSN team the AU summary Excel file in order to receive confirmation of successful AUSDS validation. In addition to the Excel file, and as part of the vendor registration process, we are also now following up on, sorry, I lost my, let me start over. Once you're ready to send us the file, please do, and we can confirm validation. So in addition to the Excel file and part of the vendor registration process, please also include the following additional information: vendor OID, vendor name, vendor software version, at least one technical point of contact, the SDS validation web service URL that you use for testing that I just discussed on the previous slide, so this is new, and vendor website, which we've recently added. If any of the information above is missing, with the exception of the optional vendor website, we will not process your request. After we receive your information, we are also now following up via email asking if you'd like us to delay posting your vendor software information on the passing vendor's website. Some of you shared with us that you may want time to incorporate the SDS validation ID into your software system and would like time to do that, hence have us delay posting your vendor information to the public-facing website. At this point, providing we've received the required information, we will test your Excel file to confirm it passes AUSDS validation. Next slide, please. If the Excel file passes, an email will be sent containing the SDS validation ID to be added to your production AU CDA files. Additionally, the vendor name, software version will be published to our public-facing NHSN webpage to highlight successful AU SDS validation. If the Excel file fails, an email will be sent indicating that the file failed, and it will list the errors received, or a subset if there are a lot of errors. You can then resume testing internally, uploading your AU summary Excel file to the NHSN web service tool as many times as is needed to not receive any errors. Once ready, follow the same steps as outlined in the previous slide for submitting the AU summary Excel file to us to confirm the file passes AUSDS. Next slide, please. So one of the most frequently asked questions we get from all of you about this initiative is how often to validate. The AUSDS validation process is expected to be completed once per vendor per software version. So starting in 2021, all vendors creating AU CDA files will need to have successfully passed the initial AUSDS validation in order for their 2021 AU CDA files to be either manually uploaded or imported via direct into NHSN. No vendors will be grandfathered in. All client facilities using the same software version will have the exact same information in the author fields of the AU summary CDAs. The NHSN team requires you to recomplete the AU SDS validation process only when major changes have been made to the AU option protocol, but you should also complete the revalidation process when major changes are made to your software that understandably might affect the AU summary data aggregation. Next slide, please. So next, I'd like to show the author section of the AU CDA and the expectations for including SDS vendor information. This slide shows an example of the XML coding of the author field. Next slide. The ID root that I've highlighted here must contain your vendor OID. Next slide. The extension must contain the SDS validation ID. I've highlighted here. As a reminder, the SDS validation ID will be provided by us, the NHSN team, to you after confirmation of successful AU SDS validation. Next slide. Vendor name, vendor software name, software version and release are currently optional fields, but having this information will streamline the troubleshooting of issues. Next slide, please. So I have one more item to share today. We are still working on creating an antimicrobial resistant synthetic data set and hope to have a beta release this year. If you would like to be a participant in the pilot phase of AR-SDS, please send an email to NHSN CDA@cdc.gov indicating your interest. Next slide. So in closing, I'd just like to emphasize that should you have any questions about AU-SDS validation or even AR-SDS validation, to please email us at the NHSN CDA@cdc.gov mailbox. Thank you for your time today. I will turn it back over to Ahmed now.
Great. Thanks, Wendy. Next, I'll cover vocabulary update. Next slide. NHSN will be moving all value sets from the HAI VOC document, which is provided with all IGs, and will be moving to VSAC. If you have any questions or would like to know more about VSAC, please reach out to Sheila Abner at the email listed here. Next slide. Next, we'll move into new changes for dialysis component coming in December 2020 10.0 release. Next slide. CR 2523, 2524, and 2367 is for CDA catch-up in adding the date fields to the 3 specific events in dialysis. Additionally, dialysis event CDAs will go from the R3D1.1 IG to the R3D4 IG. Any dialysis events with the date 2021 or greater will now use the new R3D4 CDA. We will provide supplemental documents on the NHSN website. Next slide. CR 2536 is a child CR from patient safety where the updates are being made to the HAI pathogen susceptibility data collection form. This update will be valid for dates equal to or greater than 2021. Next slide. This slide covers the compatibility changes occurring in 10.0 for patient safety and dialysis. AR summary and dialysis events will be updated to the R3D4 starting from 2021. Next slide. We have one update for the neonatal component. Next slide. Originally, we had planned to release a neonatal component in our summer release, but with all the new recent changes to provide reporting for COVID-19 data, this has been pushed out to the December 10.0 release. Please review the R3D4 IG. There will be only CDA and no UI for LOS, MEN events and denominator. Next slide. Next, we'll move into the updates for the biovigilance component. CR 2517 is for the annual update to the ISBT values. The updated list will be posted on our website under the toolkits for release 10.0. Next slide. The next slide is regarding the new functionality created for NHSN vendors. As a reminder, vendor services is currently available for vendors to request their facilities location data. Nothing new is required to use this service, as all requests and responses handled via direct CDA automation. Facilities have the option to opt out of using this service. Please visit the link for more information on how to use this service. Next slide. Next are miscellaneous updates in NHSN. This slide is a display of the percentage of CDA imports versus manual entry or CSV imports for procedures. The year-date range was selected to include completed quarterly CMS reporting, and this can also be found in our recent newsletter. Next slide. Just a quick update for direct CDA automation. We are at 20 vendors submitting via direct. The number of facilities sending via direct is slowly increasing and is now greater than 7,000 facilities. NHSN is constantly working to improve this service and looking into streamlining this process, and we have made many upgrades for direct. For those of you who don't use direct yet, it is a batch submission process with no immediate reply. Turnaround time is based on the volume of messages in the queue. If you are new to direct or want to learn more about direct, there is a direct toolkit on our NHSN website. Before you start your process, we recommend that you schedule a call with us. We'll be happy to discuss the direct process and recommend best practices. A developer and direct administrator will join the call for technical discussion. Next slide. CDA support is available on the NHSN website. The first link is to the main CDA submission support portal. Other important links provided on this slide are to the CDA toolkits and guide to CDA versions. And just as a reminder, NHSN supports CDA versions that are valid for the past 2 years. Next slide. A few more helpful resources may be found using the following links. The first one is the NHSN newsletter, release notes and communication updates, and the last is the defect list and release schedule. Next slide. NHSN pre-production test site, or NPPT, is available for all vendors. NPPT allows vendors to test their code prior to NHSN deployment. To request a test site, please follow the instructions on this slide and send completed forms to the CDA team. Next slide. When logging into NPPT, please read important message at login. Any issues found in testing, send an email to NHSN CDA at cdc.gov. Next slide. Future CDAs coming in 2021 will be for long-term care and outpatient procedure component. OPC will include an event and denominator for same-day outcome measures, a new surgical site infection SSI event, and a new denominator for procedure. Next slide. And as always, we welcome any feedback. If you are not on the CDA distribution email, please let us know. The CDA team is also offering one-on-one quarterly meeting with vendors. Send an email to the CDA inbox if you had not had a chance to schedule a call with us and would like to. Please include any topics of discussion so the proper team is on the call. Next slide. This concludes our April 2020 CDA presentation. Before we end the call, we do have our Deputy Branch Chief on the call, Andrea Benin, who will provide some more updates regarding COVID-19 data. We will turn off the recording after her updates. Thank you. Andrea, I'll let you take it over.
Thank you very much, Ahmed. You guys are able to hear me okay, I assume?
Yes.
Great. I just wanted to thank everybody for being on the call here today. And at the beginning of the call, Ahmed went through the activities that we are undertaking around data collection for the COVID-19 module. In case there are questions out and about right now, I do want to just make sure that folks realize that submitting to the NHSN module does fulfill the request that was sent out by Secretary Azar in a letter to hospital administrators on Friday night. And As many of you may know, we have spent a handful of days and over the past couple of weeks working with many of you to set up a way for vendors to assist the facilities in submitting data in a batch fashion into the NHSN COVID-19 module. And we are, we remain committed to that functionality and are happy to take any questions around that functionality. The idea right now is that vendors would obtain the org ID from the facilities that they're working with, and then those facilities would, by giving that org ID, would give a sort of an implicit opt-in, and the vendors would be able to submit data directly to us. We are setting up some particular pathways depending on the vendor for ways for the data to get in to NHSN. And so I think it's probably relevant to reach out to us to make sure that we've given you the appropriate instructions for you to submit on behalf of your customers. I think that if there are questions around that, I think we're happy to take them if there's a way for folks to put anything into the question box. We're happy to take those questions and try to answer them now, or alternatively, feel free to reach out to me. But NHSN is committed to providing a vendor neutral platform for the submission of data regarding the COVID-19 public health crisis so that we can create a national lens into what's going on in the different areas. And so we are happy to facilitate helping you submit on behalf of your customers if you're in a position to do that. So I just want to stop. I don't know if there are any questions at all, or if there's I see there's a Q&A box that we can look at. So if anybody has any questions, feel free to go ahead and ask them here or to email us afterwards. And you can certainly email me directly, and my email is aqb4@cdc.gov. That's Alpha Quebec Bravo, the number 4 at cdc.gov. So if there are particular questions about vendor submission into the COVID-19 module, we are happy to take them and to assist with that. I'm not seeing any questions come in right now. So I'm going to turn it back to Ahmed and let everyone wrap up from here.
Great, thanks, Andrea. So we'll go ahead and stop the recording now, and we'll give you guys a few minutes. If anybody has any questions, you can go ahead and put in the Q&A box. And if not, then you can always send an email to NHSN CDA@cdc.gov, and we'll be happy to answer any questions afterwards.